Palpating the superficial pulse points. Severe fluid or blood loss can result in hypovolemic shock. A rapid yet weak pulse is one of the first signs of hypovolemic shock. Pulse rate is one of the vital signs that clinicians use to assess circulatory efficiency because it is an easy way to measure heart rate. This video will explain why a pulse can be felt and demonstrate how to locate a few superficial pulse points. Arteries expand and recoil as a result of the different pressures seen during systole, contraction of the ventricles, and diastole, relaxation of the ventricles. This difference between the systolic and diastolic pressure is called a pulse pressure. The expansion and elastic recoil of the artery can be felt at the surface of the skin, where a superficial artery is pressed against firm tissue. Let's check your understanding. Which of the following explains why we are palpating arteries and not veins? Arteries are located superficially and veins are located deep. Arteries are subjected to surges of pressure, causing them to expand and recoil. Arteries have a larger lumen than veins. Arteries usually carry blood that is oxygen-rich, and veins carry blood that is oxygen-poor. The correct answer is arteries are subjected to surges of pressure, causing them to expand and recoil. To take a radial pulse, place the tips of your index and middle fingers over the lateral wrist in line with the thumb. Take care not to press too firmly because you might close up the vessel. The thumb should not be used because it has a pulse. In addition to counting the pulses per minute, you will describe the regularity of the pulses and the strength of the pulse felt. The carotid pulse is usually a strong pulse because it is close to the heart. The common carotid artery is palpated on either side of the neck, below the angle of the jaw. Let's check your understanding. Which of the following would you expect to have the weakest pulse? The brachial artery, radial artery, popliteal artery, or carotid artery? The popliteal artery is palpated at the back of the knee. Of the arteries listed, the popliteal artery is the farthest from the heart. The brachial pulse is felt in the cubital fossa, the triangular depression on the anterior surface of the elbow. You will need to locate this pulse point when measuring blood pressure, because the brachial artery is auscultated when measuring arterial blood pressure. Arteries are higher pressure vessels than veins. Recall that this pressure varies with the contraction and relaxation of the left ventricle. This results in a pulse pressure. Before heading to the lab, attempt to locate some of the superficial pulse points discussed in this video, and a few others that are shown here.